Hello, everyone. Stefan Hartman here, PA, exercise science specialist and primary care provider at Iron Direct Primary Care. I'm bringing you all a new lecture this week on how to improve mental health with a nutritional approach. Now, nutrition and psychiatry or psychology, oftentimes they don't go hand in hand, unfortunately. It's a big gap in our mental health system, and a lot of providers are not aware of how powerful nutrition is. We're going to go through it today. We're just going to give you kind of a brief overview of things that you can do to change dietary habits and then also to improve mental health and some of the data supporting this and why it might be the case. Why is diet affecting mental health so much? So some studies out there on the effects of fish oil, omega-3 fatty acids, supplementation on mental health, some randomized double-blind placebo-controlled trials. They found it's pretty powerful, essentially. So they did one here, 60 women with PCOS, aged 18 to 40 years. Participants were randomly assigned to two groups to receive either 1,000 milligrams, so about 2,000 milligrams of fish oil daily, or placebo. Results, omega-3 fatty acid intake led to significant improvement in depression inventory. So this review shows that omega-3 fatty acids are effective in the treatment of elderly depressed patients. So another review showed that omega-3 fatty acids were effective in the treatment of elderly depressed patients. The benefits of omega-3 fatty acid supplementation were significant in the elderly patients with mild to moderate depression. So pretty cool supplements with just fish oil. So they're just looking at that. But when we look at the whole animal-based food, so the salmon, we're going to get a lot more benefits with this. So a lot of these, it's really cool to do a study with just one supplement like fish oil because it's easy to look at that, right? But just fish oil, it misses a lot of other key micronutrients and vitamins. So I always recommend getting it from the whole animal source food. If you can get it from salmon, your omega-3s, that'd probably be the best. So inflammation as root cause in depression. So very cool analysis by Biological Psychiatry, a meta-analysis of cytokines in major depression. The meta-analysis reports significantly higher concentrations of pro-inflammatory cytokines, TNF-alpha and IL-6, in depressed subjects compared with control subjects. So interleukin-6 is elevated in the cerebral spinal fluid of suicide attempters and related to symptom severity. So these inflammatory cytokines, these have been in the press a lot lately in relation to COVID-19. And we're seeing just how powerful these are in so many different disease processes. But really just COVID has put it on the map for people, and they're now more aware of this. The role of inflammation in depression and fatigue. Studies have extensively probed these interactions and found that subjects with depression and fatigue have higher levels of inflammatory immune activation, along with a host of other immunological changes. These changes can, among other things, be used to predict treatment and efficacy and future fluctuations in patient well-being. Early observations about the link between the immune system and psychological responses occurred in the context of cytokine-induced sickness behavior and immunotherapies such as interferon alpha in the context of hepatitis C treatment. Cytokine-induced sickness behavior is a syndrome characterized by decreased activity, depression, and loss of energy because of increased circulating levels of pro-inflammatory cytokines. And again, big study that I think I've brought up before was anxiety and depression in COVID-19 survivals, role of inflammatory and clinical predictors. The highlights of that study showed that in COVID-19, there is a relationship between illness severity and psychiatric diagnoses. So 55% of the sample presented a clinical score for at least one mental disorder. Psychiatric history, setting, and length of hospitalization influenced psychopathology. Females suffered more than males, scoring higher in all measures. There is need to diagnose and treat psychiatric sequelae in COVID-19 survivors. Now, salmon is an anti-inflammatory food. That's why I'm a huge proponent of an animal-based diet, not with just supplementing in isolation. We want to get the whole animal source food, and salmon is super powerful in how it acts on inflammation. Now, what does it do here? So there's a lot of things that salmon does, and omega-3s is just one small part of it. So you can find DHA in salmon. So DHA influences serotonin uptake by making receptors more sensitive, which makes the uptake more effective. This means that when levels of omega-3 fatty acids are low in the blood, the body may not utilize serotonin efficiently. What else does salmon have? It has tryptophan. So tryptophan is the sole precursor of serotonin produced in the body and is therefore necessary for the production of serotonin. However, because the body cannot manufacture tryptophan, it must be acquired through dietary sources. Tryptophan is highly available in a variety of protein-related food sources, with wild Alaska salmon and halibut being really good sources of this amino acid. Now, oftentimes depressed patients will go towards carbohydrates because carbohydrates also have a rich source of tryptophan. But when these patients do eat the processed carbohydrates, what they'll get is like a rebound effect. They'll go into binge eating habits. So what will happen is they'll get a kind of a high from the processed carbohydrates. They'll get essentially kind of an opioid release. And they'll binge a lot on it, and then later on they'll crash. That can be from the glycemic crash. Maybe these patients are insulin resistant, so they have a crash, and they feel better. They feel worse afterwards. So this causes a cycle of binge eating. So that's why I do recommend a lower glycemic source of food, higher fats, protein leveraging to kind of avoid this binge eating cycle. Cytokines and inflammation. So again, with the salmon here, perinatal depression. According to the CDC, 1 in 9 women, at about 10 to 20%, experience symptoms of postpartum depression. So how do we fix this? The amount of omega-3 fatty acids in the blood decline during pregnancy and lactation because of the fetus's uses omega-3s for the development of its nervous system, and the mother's body uses omega-3s after birth to make breast milk. Unfortunately, most pregnant women's diets are inadequate in omega-3s due to low consumption and dietary sources high in omega-3s, such as seafood. Because of this, blood levels of omega-3 fatty acids in pregnant and breastfeeding women may not be optimal and can impact not only child development, but may also put a pregnant mother at risk for the development of postpartum depression. The mechanisms by which increased seafood intake reduces rates of depression is still under investigation. But a key link is inflammation, as we've alluded to in a couple other studies here. Inflammation that increases levels of pro-inflammatory cytokines, such as IL-6, IL-1B, TNF-alpha, are known to result in depression and inhibit memory. EPA and DHA, which are found in higher quantities in seafood and are known for their anti-inflammatory, antioxidant, and neuroprotective and neurogenesis effects. So a lot of reasons to be consuming wild-caught salmon and seafood to treat not only inflammation, but depression as well. Let's move on to the cholesterol. Total cholesterol and suicidality in depression. It's an old study from 1994, and it found an association between low cholesterol and suicide. So they used data from about 10,000 or 8,000 individuals who completed a depression screening and blood collection. Another study, prospective plasma lipid profiling in individuals with and without depression. Depressive individuals were found with adverse plasma lipid patterns of higher triglycerides and lower HDL cholesterols compared to healthy controls. So again, another study here in biological psychiatry showing that the same lipid fractionation profile that would indicate a patient may be at risk of having a heart attack or stroke also indicates that they're at risk for depression. So quite powerful to look at depression from a blood chemical analysis. We're looking at a lipid profiles and seeing that we're having the same risk factors here for both MI and CVA and depression. So essentially, high triglycerides, high ApoB lipoprotein, the low density lipoprotein with the lipid fractionation tending towards the pathologic side. Woo! Sorry. My God. Let's see, what else? I think we'll leave it at that. That's a pretty big statement there. Diabetes, insulin resistance, and depression. Insulin resistance as a shared pathogenic mechanism between depression and type 2 diabetes. So, type 2 diabetes patients have elevated circulating levels of pro-inflammatory markers, in particular of the cytokine tumor necrosis factor TNF-alpha. Clinical studies indicate that blood concentrations of the pro-inflammatory cytokine tumor necrosis factor correlates with depression and impaired performance on memory tests. So again, the consistency here among the studies with the pro-inflammatory cytokines. Again, here's a couple more. Brain insulin resistance, a treatment target for cognitive impairment and anhedonia in depression. Insulin resistance in brain alters dopamine turnover and causes behavioral disorders. We're going to move on towards the gut now. So the gut microbiota in anxiety and depression, a systematic review, absolutely brilliant study here. Differences in bacteria taxa indicated disorders may be characterized by a higher abundance of pro-inflammatory species, Enterobacter and Disfulvibrio, and lower short-chain fatty acid producing bacteria. Several taxa and their mechanisms of actions may relate to anxiety and depression pathophysiology via communication of peripheral inflammation to the brain. Although the gut microbiota remains a promising target for prevention and therapy, future research should access confounders, particularly diet and psychotropic medications. Let's talk about bread and other edible agents of mental disease. We present the implications for the psychological sciences of the findings that in all of us, bread makes the gut more permeable and can thus encourage the migration of food particles to sites they are not expected, prompting the immune system to attack both these particles and brain-relevant substances that resemble them, and release opioid-like compounds capable of causing mental derangement if they make it to the brain. A grain-free diet, although difficult to maintain, especially for those that need it most, could improve the mental health of many and be a complete cure for others. So that's a pretty big statement, and if you talk to most psychiatrists, they would be like, what? Bread has nothing to do with psychiatry. But let's go on here. Schizophrenia and wheat consumption, bread and other edible agents of mental disease. One of the first hints that these circumstances could have implications for the psychological sciences was the observation that in several countries, hospitalization rates for schizophrenia during World War II dropped in direct proportion to wheat shortages. In the United States, where over that same period the consumption of wheat rose rather than diminished, such rates increased instead. In South Pacific Islands, with a traditionally low consumption of wheat, schizophrenia rose dramatically when Western grain products were introduced. The next three sections present the implications for the psychological sciences of the facts that bread increases the permeability of the gut and likely the blood-brain barrier. Let's see. A post-mortem study of 82 schizophrenic patients found that rates of stomach, small intestine, and large intestine inflammation as impressive as respectively 50%, 88%, and 92%. The association between gastrointestinal pathologies and psychiatric disorders had already been noticed at least 2,000 years ago and been confirmed repeatedly. It is worth noting that psychological stress worsens gut permeability. Yes, of course, there's always the psychosocial part of this, but we're going to focus more in this lecture on the nutrition aspects. Alarmingly, blood markers of the disease have quadrupled in the United States in the last 50 years and doubled in Finland in the last 20. Measurements were taken all at once on blood samples collected and frozen decades apart. Hence, the recent surge in the disease cannot be due to better detection or more lenient diagnostic criteria. Markers also increase within the same group of individuals over time, showing that an abnormal immune response to gluten can suddenly emerge in adulthood. So yes, it traditionally was thought that you can't develop an allergy to gluten later in life, but you can. So here's a very cool diagram of what actually is going on here. So we have these tight junctions here, and when you increase your consumption of gluten, what can happen is that these junctions, they widen apart, and then the foods that you ingest, they can go through this single cell membrane barrier in your gut, and then these particles enter your bloodstream. And what do you think happens when a foreign particle enters your bloodstream? What does your immune system do? Well, it attacks it like it's an invader, of course. This increases an immune response, an inflammatory response, and the patient goes into a cycle of constant autoimmune response to foods they're ingesting. Unfortunately, gluten resembles some brain-relevant substances too. In vitro, antibodies against gluten removed from human blood attack cerebellar proteins and components of the myelin sheath that insulates nerves. They also attack an enzyme involved in the production of GABA, our prime inhibitory neurotransmitter, whose dysregulation is implicated in both anxiety and depression. In the blood of blood donors, antibodies against wheat or milk and antibodies against these brain-relevant substances have been found to be simultaneously elevated, consistent with the presence of a cross-reaction. Most of us escape it only because our gut and blood-brain barriers are intact, and only as long as they remain so. Antibodies against the brain, triggered by gluten, can cause severe neurological dysfunctions, whether or not one is celiac. Similar antibodies have also been found in the blood of a subgroup of schizophrenia patients. Some of them carried blood markers of celiac disease, but others did not. And that's a really critical thing, because in conventional medicine, we determine that only if a patient has the diagnosis of celiac disease do they need to avoid gluten. But here I am proposing that no, celiac disease is not the only reason you should avoid gluten. There are potentially other reasons you may want to avoid gluten. I think that's enough on schizophrenia and gluten. Let's go here. A lot of that on this. Cow milk. So we'll talk a little bit about that. So there's a difference in cow milk we buy at the store. There's A1 and there's A2 milk proteins. One of the major milk proteins is beta-casein. Beta-casein has 209 amino acid residues in its protein chain. And its gene, CNS2, belongs to the cluster of 4 casein genes located on chromosome 6. The most frequent genetic variants of CNS2 are A1 and A2 milk, and you can actually find these at Walmart. Walmart is now branding A2 milk in their store. You can see it there. Bioactive peptide beta-casomorphin 7, which originates mostly from beta-casein variants, may be a significant risk factor in human ischemic heart disease, arteriosclerosis, type 1 diabetes, sudden infant death syndrome, and autism. Epidemiological evidence from New Zealand claims that consumption of beta-casein A1 is associated with higher national mortality rates from ischemic heart disease. So that's pretty significant. So we're consuming milk proteins, the A1 milk traditionally, from a certain breed of cow that's prevalent in the US. This is inflammatory. It's increasing inflammatory markers, it's causing increased risk of heart disease. This could play a role in mental disease as well, if we follow the same theory that mental disease is associated with higher inflammation and cytokine markers. But I think that dairy has great nutritional properties to it. The key would be finding one that we can absorb better and digest better. So yeah, getting an A2 milk protein would be one step. But then the pasteurization process poses another problem. When you do a pasteurization process, it eliminates a lot of the enzymes, a lot of the probiotics that allow us to digest this in the first place. I may do a lecture on kefir at some time, but kefir, raw kefir, is super powerful with its probiotic profile, this live probiotic culture profile. It's super anti-inflammatory. So if you can add this back into the diet, it might be actually a helpful version of dairy. I'm not for completely eliminating daily. Maybe initially for some patients, but then gradually reintroducing it with the form of an A2 raw kefir, maybe something that could help heal the gut. Another thing that we have to talk about, obviously, to remove inflammation from the diet are the processed seed oils. We've talked about that many times here. You want to cut them out. They're inflammatory. They're going to increase all your cytokines. We're going to get out the canola oil, cottonseed oil, all that stuff. We take that out. We're going to try to reintroduce salmon, animal source foods that have a better lipid profile. And we have to talk about exercise as well. Exercise to treat mental health disorders. It's pretty well known that exercise helps. A couple studies here, you can look at that. Even in schizophrenia, ADHD, not only just depression. Exercise reduces depression and inflammation, but intensity matters. Depression increased, demonstrating how quickly mental health can decline for students during their academic term. In contrast, what does MCST stand for? Oh, moderate continuous training, decreased depression and pro-inflammatory cytokines and TNF-alpha levels. Although high-intensity training decreased depressive symptoms, it also increased perceived stress. TNF-alpha and IL-6 relate relative to moderate intensity training. Moderate continuous training. Jeez. This may be due to high levels of physical stress evoked by the strenuous exercise protocol. Yeah, I'm not a huge fan of like these triathlons or marathons. I think they put too much stress and too much inflammation on the body. Vitamin D and mental health, obviously a big one here. The effects of vitamin D and probiotic co-supplementation on mental health parameters, metabolic status in type 2 diabetic patients with coronary heart disease, a randomized double-blind placebo-controlled trial. Overall, vitamin D and probiotic co-supplementation after 12 weeks among diabetic people with coronary heart disease had beneficial effects on mental health parameters, CRP, which is an inflammatory marker, glycemic control, and HDL cholesterol levels. So yeah, if you can get your live probiotics from some great kefir or maybe some low sugar source kombucha, and you can get vitamin D. I don't recommend just exogenously supplementing with a tablet. Sure, if you're not getting enough in the diet, but you should be getting enough diet sources. Fish being a huge one, meats, butter, so raw unpasteurized butter, and then obviously sunlight. But then even then, sometimes you might need to supplement still with it. So conclusions: diet is an under-recognized variable in mental health. Salmon and wild-caught fish provide essential micronutrients, vitamins, and omega-3s, and vitamin D to provide improvements in mental health. Diet can reduce measurable changes in mental health parameters through cytokine and inflammatory marker measurements. Insulin resistance and mental health disorders are inextricably interlinked. Exercise is a well-known modality that improves mental health. However, moderate intensity exercise provides greater benefit. I'm not a huge proponent of pushing yourselves in like CrossFit or triathlons or marathons. I think those are a little bit too hard on the body. They can cause actually more inflammation, especially if you're not providing the right nutrition and recovery time. Inflammation in diet can come from a variety of sources, from seed oils, gluten, some dairy products, in addition to the established inflammatory sources, which is tobacco and alcohol. We didn't really go over that one, but I figured everyone kind of knows that you shouldn't smoke and you shouldn't drink alcohol if you have depression. I think that's a no-brainer. I hope you guys enjoyed this lecture. I'm going to leave a link for the show notes because there's a lot of cool articles in this one. Hope you guys enjoy this video, and maybe you'll be able to make some changes to improve your mental health with just some simple nutritional changes. And again, join us here at Iron Direct Primary Care for holistic primary care providers who really, we don't just look at medications, right? We want to look at the whole picture. We want to see where the inflammation is coming from, nutrition, exercise, lifestyle habits. And yeah, medication always has its role, but the lifestyle parameters I feel are hugely under discussed in psychiatry. Obviously, you can't figure it all out in a 15-minute meeting with a patient. You need to work with someone one-on-one, sometimes for months, to figure it out. We didn't even talk about sleep, and the sleep is another huge factor of this. So a lot that goes into mental health, you can't figure out in a 15-minute meeting with your psychiatrist. You need to talk to someone, work one-on-one with them to figure out mental health disease. Hope you guys enjoyed this lecture. I'll see you all next time.